So get ready for the session, take your notes. Yes. So we are going to start the session shortly. Whether anybody comes or not, it doesn't matter. So, yes. So who is there? Dr. Momal. Yeah, can you share something about yourself? Yeah, otherwise you can just type in the chat box. Okay, yeah. Yes, Dr. Momal, you can share about yourself. What are the problems you are facing in writing? Just an introduction about yourself. Otherwise, you can chat in the chat box, no problem. Yes, there are some more students who will come and join. Yeah. Assalamu alaikum. I am new here, no problem. You are always welcome. Okay. So I just completed my graduation from Pakistan. Okay, that's good. So why are you intending to do the OET? What's the reason? That's really good. Congratulations for completing your graduation. You have some goal. You have some target. Yeah, for PLAB. Okay. So with this, you can register for PLAB. Yeah, that's fine. That's really excellent. Yeah, what do you know about OET? Yeah. Yes. So another person joined here. Yeah, Pranita Pamarti, very good. Yes, type your first name and second name. Pranita Pamarti is a regular student. Yes. Pranita Pamarti, what problems are you facing in OET writing?
Hi, sir. Good morning, sir.
Yeah, good morning. Yeah. So write your problems related to OET writing. Yes, Anjana Yadav. Write your name, first name and second name as usual. Anjana Yadav. Okay. Anjana Yadav. Make sure that your name will come like this always when you are joining. So you can register like that. A capital, Y capital. and remaining small letters. Yeah. Yes. So we are going to do yet another writing task, how to write sentences, how to build up quality. Yeah. Sentence formation is a big task, very big task. Okay. Right. So, yes, then we have Blessing Erisaba. Very good. Blessing Erisaba, type your first name and second name. Yes. So, right. Momal Chowdhury. Yes. Good. So this is the case notes. So I have given here also. You can download from here. Copy post link. This is the post link. If you click on that, it will take you here and you can download, okay, the case. Here it. Okay, you can go through this now for a few minutes. Yeah. Yes. So next, slowly we are moving. Yes, we have got 7 students now. iPad. Can you please write your name, first name, and second name, just for my reference? Thank you very much. And iPhone. Okay. Your first name and second name, please. So, because I cannot call you iPad or iPhone, so just write your first name and second name. Yes, 1, 2, I have named. So iPhone, I think. You can change your name or you can type your name so that I can change the name. Yeah. Yes. So go through the case notes. Second page. Yes, we have reached 8 members. Yeah, this is the writing task. Yes. Fareed Ahmed. Hello, Dr. Fareed. How are you? Dr. Fareed from Pakistan. How are you, dear? Fareed from Saudi.
Hello.
Yeah, is this the same Fareed?
Yes.
Yes. How are you, dear?
I'm good. Yeah.
Yes, good to see you back. Okay, fine, no problem.
Okay. Okay.
Yeah. So, right. And now we are going to write the letter. So we'll eliminate some distractions here. Yes. Get ready for the big show now. So, yes, 10 members, we are off. That's good. So, now first and foremost, I want you to write your difficulties in writing. What are the difficulties that you're facing in writing? If you have, you can just take 1 minute and think about all the difficulties, and you can write there so that we can focus on those areas. Yes. Right. Jab tu tha yili sutha yili. So your name, please. So first name and second name, please. Yeah. So Anjana is a regular student, Blessing is a regular student, Farid a regular student, then Muthu Lakshmi, yes, then Pranita Pamarti, yes. So fine. Now we are moving forward. So now we are going to start writing the letter. Yes. Now let us see how we are going for the relevant information. Now let us see what we are going to write, where we are going to write. Read the case notes below and complete the writing task. Mr. Brett Collister is patient in your general practice. So this is, you are a general practitioner. You are a general practitioner, and the name of the patient is Mr. Collister, and his date of birth is 21 December 1973. So during the initial 5 minutes, you'll be going through these things normally. So here, treatment record. So general practice. So visits are there, lot of visits are there. Then next one, see, many visits are there. The next one here, preliminary diagnosis. Results indicate, means signs and symptoms suggest that it is, results indicate, preliminary diagnosis. Remember this one. This is not definitive diagnosis. This is preliminary diagnosis. Okay. And it suggests type 2 diabetes mellitus. So that's it. So signs indication. Indication means signs and symptoms. Results show the signs and symptoms of diabetes mellitus type 2. So you are sending it for a definitive diagnosis. Preliminary diagnosis you have done, and assessment, further assessment, and then appropriate management plan. Okay. So you are writing a letter of referral. So this is a referral letter. This is a referral letter. Remember that. And you are writing to Dr. Grantley Cross, and he is an endocrinologist. Okay. So Dr. Grantley Cross. Right. So Dr. Grantley Cross is here. Then consultant endocrinologist. Okay, so endocrinologist no need, and consultant endocrinologist is here. Then City Hospital. Then Suite 32. '55 Main Road. And Newtown. Okay, these are the information. Okay, this is the information provided. That's very clear here. So like this, you have to find out some things. Now let us see what more are important. So this is a regular visitor. Is visiting number of times 1, 2, 3, 4, then 5, 6 visits, multiple visits. Multiple visits. So this is a referral letter. You can understand from here also. Okay. This is not a transfer letter. This is not a discharge letter. This is just a referral letter. Okay. He's a known case to you, but he's not a known case for that one and the other person. So you are giving a referral letter. Remember that. So, right. Now, if you take this one very clearly from here onwards. Okay, Control C. So, Dr. Grantley Cross, no need comma, consultant, endocrinologist, enter, no need comma, City Hospital. Okay. Then Suite 32, 55 Main Road, Newtown. Yeah, this is number 1. This is the address you got here. This is the address you got here. So this is number 1. Number 1 is the address. Number 1 is the address. You got the address here. Then after the address, you'll go for the date. The latest visit is this one, 24/2, 2018. 24/2, 2018. Yes. 24 February 2018. Okay. So you can see that very clearly here. 24. This is the last visit. So you can take it. Okay, that's the date, last visit. So you are writing a letter on that particular date. So you'll be writing the same thing here. What you're going to write? 24 February 2018. 24 February 2018. So this is how you'll write. Okay. This is how you will write. Let us take here. Okay. This is number 2. This is number 2. The date. Number 2, the date. So this is the second point. This is the second point, the date. Yeah. Fine. Then next one. Next one you can see here. Number 3 is salutation. Salutation will come from here. Doctor and cross. So these will come here. So salutation will be like this. Dear Doctor Cross, comma. Dear Doctor Cross, comma. Number 3 is called salutation. Number 3 is the salutation. After number 3, number 4 is the subject line. Subject line, you will get it here, Brett Collister. So these things only you have to write. This is the subject line. So you'll say regarding, colon, Mr. Brett Collister. Be careful with the spelling. Then, comma, DOB, colon, space 21, December 1973. Regarding Mr. Brett Collister, comma, date of birth, colon, 21 December 1973. This is called the subject. So number 4, the subject. 4 is the subject. So preliminaries we have finished. Next is the body part. Next is the body, number 5. Number 5, let us take it, the body. We'll write here. Number 5, the body. Number 5 is the body. Okay. Let it be like that. Number 5 is the body of the letter. Here we place it. 5th is the body. Then 6th one is based on this one, salutation. Salutation says, dear Dr. Cross. Name of the doctor is Cross, Grandly Cross. So you know the name of the doctor. You're not calling dear doctor. If you say dear doctor, then yours faithfully. But here, this is closing remarks. Number 5, number 6. Number 6. The closing remarks. The closing remarks. How you will write the closing remarks? Yours sincerely, comma. Yours sincerely, comma. This is the closing. These are the closing remarks. So if you don't know the name Cross, and if it is dear doctor, then you'll write yours faithfully. So you know the name of the doctor personally. So personal name, okay, official name. So you are writing yours sincerely. Remember that. Next, 7th one, your address. So here nothing is given about you. So which hospital is not given? Just a male, Mr. Brett Collister is a male patient in your general practice. So you will just write what? General practitioner. So just write general practitioner. Okay. Right. General practitioner. We don't know the name of the general practice. We don't know which street. We don't know anything regarding your practice. Only we know that you are a general practitioner. That's all. So just write general practitioner and leave it. So now we finished with all the aspects. Now let us recall this one. Yeah, this is the sender's particulars. Seventh one, the sender's particulars. The sender's particulars. Okay. So these are the 7 particular points we have. Right, that's very clear. These are the 7 particular points we have here. Okay, so these are the labels 1, 2, 3, 4, 5, 6, 7 are labels. Okay, now let us check once again, revise. Let us revise this. Sorry, let us revise this one. Now here, first one is the address. First one is the address. I am giving blue marks. First one is the address. Okay, then second one is the date. So first you'll write the address, then leave one line and write the date. And then the third one is, okay, salutation, the salutation. And fourth one is the subject line. Subject line you'll get here. Okay, then the fifth one is the body. Fifth one is the body of the letter. Then sixth one is the closing remarks. Okay, closing remarks. Okay, then seventh one is sender's particulars, your address. Right, that's what it is. Now let us go. What are the information we got and where from we got it? So this information we got from green. I'm putting it green color, so because it is going directly to the letter. So that is fine. So you have seen very clearly here now. Then next one, this address you got from this writing task. Number 2, date. Date you got from the last visit, or in the beginning they will give. Okay, that is current date or today's date they will give in the beginning itself sometimes. Okay, then next one. Next one, number 3. Number 3 is salutation. Number 3 is salutation. Dear Dr. Cross, comma. That is salutation. Number 4 is the subject line. Regarding Mr. Brett Collister, date of birth 21 December 1973. If age is given, write age. If date of birth is given, write date of birth. If both date of birth and age both are given, then write date of birth only. That's how you can use. Then next one, last, closing remarks. Closing remarks, then the sender's particulars. General practice. Okay, now let us take the answer sheet. Let us take the answer sheet, single sheet. Single sheet. Okay, single page. Okay, fine. Save as. Okay, this is Brett Collister. Take your notebook and try to write Mr. Brett Collister. Okay, so this is the sheet. Yeah, this is the answer sheet. We want to maybe 2 pages. Maybe lecture I am giving you so you will understand many different things. So we'll take 2 extra pages. This only single page. What I'm doing is I'm making extra pages, okay, so that we can write whatever we want. So we are going to the first page. First page, leave the topmost line and start from here. Okay, start from here. Okay, from the left margin, from the first dot you have to write. You see how P is written. From top first dot you have to write and try to write in the last dot. That will be very beautiful. So now we know the address. Just we'll take this address. Okay, you will write there in the notebook. So that is it. Grandly Cross. Right. Consultant endocrinologist. Be very careful with the spelling and everything. Suite 32, 55 Main Road, Newtown. So this is how. Yeah. Right. That's finished. Address is finished. The first point is finished. Then leave one line. Leave one line. Leave one line and write in the next line what? Date. So date. Okay. Write the date. Many people write a date first. So don't write date first. How it is given in the sample letter, see that one and follow. You want to see, check. See, first address will come, then only date will come. Date also, they will not give figures, okay? They'll give month name, February, like that. First address only will come, remember. Okay. So I'm telling you means with proof I'm telling you. So any letter you see in the official letters, first address, then date. There's a formal style. So some people write like other ways. That is not a problem, not our problem. We know some rules, we are following the rules, that's all. We don't mind whether others follow it or not. Okay, right. Here we are going to write the date. Now date is, so this is the date. We have taken here. So copy. Yeah, this is the date, 24 February. We are leaving one line. Then we are writing here 24 February 2018. So again, we leave one line and give salutation. Salutation is here. Salutation, dear Dr. Cross. Copy text. Okay. Dear Dr. Cross. That's it. Okay. So dear Dr. Cross, comma. That's it. Nothing else is needed. Second name you have to write, not first name. Cross. Like the second name you have to write. Then again leave one line. And again here you have to write subject line. Subject line is here in the beginning. Yeah. Copy text. So this is the subject line regarding Mr. Brett Collister, date of birth 21 December 1973. So that's what it is. Nurse's letter or doctor's letter, that doesn't make much difference. As a doctor, you are official representative, you write powerfully. Nurses write what you tell, that's all. There is no difference. Sentences are the same, grammar is the same, vocabulary is the same, style is the same, everything English is the same. So only the thing is, you will be writing as a doctor, they will be writing as a nurse, that's all. There is nothing problem. Same case notes can be taken for doctors and nurses. Okay, not for other professionals, but doctors and nurses almost it will be same, because the nurses are substitutes for doctors here. Other than diagnosis, treatment, okay, follow up, everything is by nurses only. Okay, what nurses are doing is because doctors are saying, so they represent one another, that's all. So follow it very clearly. Yes, good afternoon, Vinay. Yeah, fine. Next one is, so four things are over: address, date, salutation, and subject line. Next, it will be body of the letter. So body, the body of the letter. So referral letter. Yeah, referral letter will be like this, something. Okay. Let us take like that. Just I have given, okay. So fifth one, the body of the letter. There are 5 paragraphs: the introduction, the main problems, the other important problems, the discharge plan, the conclusion. This is not discharge plan, so this is a referral letter. So something else form will, I'm just giving you. So this is the body paragraph 1, BP1. and this is the body paragraph 2. Body paragraph 2, and this is body paragraph 3. Yeah. So the body paragraph 3. BP means body paragraph. Okay, body paragraph 1, body paragraph 2, body paragraph 3, and then the conclusion. This is how you will be writing. And you will go to the next page and you will write till here. First line, leave again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So leave one line. Leave one line and write in the next line. So you can start from here. Okay, what is that? Okay. So here, 10 lines you leave. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And afterwards you leave one line and you'll write yours faithfully here. Yours sincerely. Yours sincerely. Yours sincerely. Okay. Yours sincerely. Then again leave another line and 2 lines you leave. Not one line, 2 lines. You leave and say medical practitioner or doctor. Medical practitioner. Finished. So if address is given, you can write the address also. So this is the way how you will have the letter. So far so good. Till there, is everything clear? Okay, OnePlus. iPhone did not give name. OnePlus did not give name. I'm requesting names. So first, second, right, please. I'm saying please write your first name and second name so that I can know that I'm teaching to students and not phones. That's all. Right. Please type your first name and second name. Right. Yeah. So this is how your letter format will be. You can see there. So this is first page. This is second page. Till here the letter will go 5 paragraphs. You're sincerely medical practitioner. That's very clear. So till now, is the information clear? Is the information clear? Because we are going into the paragraphs now. We are going into the paragraphs now. Just if the information is clear, write yes. If it is not clear, you can write no so that we can clarify. I'm waiting 10 seconds. Just 10 seconds. Yeah. So now we are going to the third paragraph. Just getting some tea in the meantime. So, yes. So what you can do is, right. So we are going to write the first paragraph now. The first paragraph. Okay, 5.1. Okay, the first paragraph. The first paragraph will be introduction. So that's it. So it is the introduction. The introduction. We'll be writing the introduction now. So in the introduction, what we are going to write, I'll give you the information, what you are going to write. Just check over here. Okay. So the information, what you have to write is, okay, we are writing about Brett Collister, number 1. So Brett Collister, number 1. We are writing about Mr. Brett Collister, number 1. Okay. We are writing about Mr. Brett Collister, number 1. So then next one, number 1, Brett Collister. Then what else you will write is, what was he diagnosed? Preliminary diagnosis. So this one you can write preliminary diagnosis. Okay. So what is it? Okay. Preliminary diagnosis. Copy text. So you'll write about the preliminary diagnosis. Okay. You'll write about the preliminary diagnosis. Fine. So then next one, what else you will write about? Okay, you was preliminary diagnosed with type 2 diabetes mellitus. Signs and symptoms suggest. Okay, because of signs and symptoms. That is right. Okay, so suggest, indicate, suggest, point out. That means, so this is also an important word. Okay, you have to take that one. So indication, right? Preliminary diagnosis, right? Signs and symptoms suggest, indicate, refer. Okay, next one. This is what type of letter that you have to see. This is a referral letter. So it is a letter of referral. So copy. This word also will come here. Type of letter. Type of letter is a referral letter. All of you be ready to write the points. Okay. All of you be ready to write the points. Okay, no problem. If anybody goes, it's not our problem. Right? So yeah. So is this Kumar? Okay. Right. So this is how it is. Next one. So preliminary diagnosis. Then next one, what does he require? What does he require? Requires what? Requires what? Requesting. You are requesting. That is what you are requesting. That means he requires what? He requires what? Yeah, requesting assessment and a management plan. So he requires these things. Copy text. So this is the purpose. Assessment. What type of assessment? This is preliminary diagnosis. This is preliminary diagnosis. Preliminary diagnosis. So he needs further assessment. Definitive diagnosis or further assessment and appropriate management plan. Okay. And appropriate management plan. Okay, you can take like that. So this is the purpose. Requires or is being referred. Okay, requires or he is going. You are sending him for what? So requires what or send for. This is called the purpose. Purpose of the letter. So this is how you are going to write. And assessment and management plan. So it's going to the endocrinologist. Okay, you're writing the letter to endocrinologist for assessment and definitive diagnosis, assessment, evaluation, okay, and management plan. So these are the points which I have given. Now you can write one paragraph. Come on. Yes, start. I'm giving you 3 minutes. Write down the paragraph. All these points should come there. Yes. So write down. Yes, prepare your own wonderful letter, wonderful introduction using these points. Yes, Pranita, Suma, Farid, okay, Blessing, Anjana, all the regular students. Others, if they want to write, they will write. Otherwise, we cannot force them. Now you write. You are regular students. You must write. Very good. One response has come. Blessing Yerisaba, very good. Don't mind whether it's doctor letters, nurses letter. You do your business. That's all. We only want sentences. We only want style. We want. Okay. Mr. Collister, C capital letter, who was diagnosed with diabetes mellitus type 2, is being referred for further assessment and appropriate management plan following the discharge today. Awesome. Awesome. Only one C capital letter. Otherwise, everything is perfect. Everything is perfect. Yeah. You'll get 3 out of 3 points in this if that spelling mistake is not there. Capital letter should be there. Yeah, come on. What about the others? What about the others? Come on. Pranita Pamarthi, very good. Mr. Brett Collister was diagnosed with type 2 diabetes mellitus. So you have to write Mr. Brett Collister, comma, who was diagnosed with type 2 diabetes mellitus, comma, requires further assessment and appropriate management plan following the discharge today. That's not a discharge, no? This is not a discharge. You have to say he is being referred. He is being referred. This is a referral letter. It's not a discharge letter. And there is no discharge also. There are only visits. Rewrite, Pranita. Rewrite. Don't use the word discharge because this is a referral letter. See here on the top. It's a referral letter. Rewrite, please. Yeah. Yes, Eden Sakar. Thank you for seeing Mr. Brett Collister, comma, who has a signs and symptoms, not sign, signs and symptoms, plural, suggestive of diabetic mellitus. And requires suggestive of diabetes mellitus, or put a full stop otherwise, and requires an assessment, a definitive, not assessment, as further assessment. Already you made some assessment, a temporary preliminary assessment, and appropriate management today. Okay, is being referred to your facility today. Blessing Erseba, you also wrote there, discharge today. It is not discharge. Okay, otherwise everything is fine. Appropriate management plan, that's enough. Is being referred. Okay, that's it. So next, two people have written. Yeah, Anjana Yadav, Mr. Collister, whose signs and symptoms are suggestive of diabetes mellitus type 2, is being referred for further assessment and appropriate management. Very good. Then Farida Ahmad, Mr. Collister, who was diagnosed with type 2 diabetes mellitus, is being referred, comma, is being referred. Otherwise, you have to remove who because you are putting a full stop in between. Yeah. Yes. Right. Come on, write down. Now we'll move to the second paragraph. Those who are not completed, you can complete. So the second paragraph. The second paragraph. The second paragraph. Okay. How will you write the second paragraph here? In the second paragraph, you have to write some points. Okay. In the second paragraph, you have to write some points here. So what points you have to write? So you have to write about the recent one. Okay, these are very fast. 22/4, 2017, 17, 17, 17. And this is 18 this year. So focus on this one. Okay, focus on this one. Right. So focus on this visit. Right. So in the before this one, he had several problems. Okay. He had several problems. You can see here, right? Infectious mononucleosis in February 2006. Okay, sore throat, productive cough. Okay, all these are infections, tonsils, inflamed. So all these things together you can write. Okay, past history you can write. Okay, he has he has had or he has a history of several infections in the past. So he has had several infections. Okay, or he has a history of several infections, like that. Whatever you want to write, you can write. So all together, all these visits together make one sentence. Okay, so several infections in the previous year. Okay, the previous year, during the previous year. So this is first sentence. All these visits, he had some problems. Okay, several infections during the previous year, that you can see here. 2017, April, June, September, and November. So previous year, and this year is second. Okay, February. So previous year he had several infections. All these roughly make one condensed sentence overall. Okay, past history of infections. Then next one, we can say several infections during the previous year. Next point number 2. Point number 2, what you are going to write. Okay, now here in point number 2, you go to the previous visit. Okay, you go to the previous visit, 4th February 2018. So 4th February 2018, 4th February 2018. That visit you have to write. Okay, that visit, what happened, you can see here. So you can see here what is the problem here. So, right, main things, important things you see here. Feels tired, run down, sore eyes, dizzy, sometimes orthostatic, possible orthostatic hypotension. Okay, so dizziness, last 3 to 4 weeks, for the last 3 to 4 weeks. Okay, sometimes, not always. Sometimes, not always. So you can see tiredness, number 1. You can see is tiredness. Okay, then run down, sore eyes, then dizziness, then you can see here other things. Okay, so based on this one, what happened, you see there. So for that reason, because of all these problems, okay, orthostatic, possible chances of orthostatic hypotension. Okay, there's a possibility of orthostatic hypotension, and then you can see dizziness. You can see dizziness, and you can see sore eyes. You can see sore eyes, and you can also see tiredness. You can see tiredness. So all these problems, because of all these problems, what happened? You ordered some blood tests. See here, you ordered some blood tests. And these showed. Now, what did they show there? What did they show there? Right. So you can see here, review cholesterol, blood sugars. Then he came. Okay, he came and review was organized here. Okay, so you can see all the points here. Glucose levels. Okay, random glucose level 13.5. Random glucose level, that is 13.5. Fasting glucose level 7.4. Okay, so you can see here random glucose, fasting glucose, HbA1c levels. Okay, so all these levels. Now if you see all these levels, what do you notice from these? What do you notice from these 3 things? Okay, so they are elevated, they are higher side, they are okay, high. So they are elevated, that is what it is, elevated. Okay. So the blood tests which were ordered, the blood tests which were ordered revealed, okay, elevated random glucose levels, fasting glucose levels, and HbA1c levels. Random glucose, fasting glucose, and HbA1c levels. All these levels, okay, so were revealed that they were elevated because of this blood test. Okay, so you will write about that one now. Now, what you are going to write? Okay, so these points you are writing is it? What are the symptoms you have seen? So dizziness you have seen. Then you have seen. Next one is what? Sore eyes, dizziness, tiredness, dizziness, sore eyes. Then what? Tiredness. Tiredness you have seen. Then other than that, what else you have seen? Okay. Fine. Feels run down, right? Feels tired and run down. Sore eyes, dizziness, orthostatic hypotension. So that also you have to write. Orthostatic hypotension. Possibility. Possibility. What is the possibility? Orthostatic hypotension. Orthostatic hypotension. So that is the possibility is there. You can see the question mark means possible. Right. The next one. That is the reason why. So consequently, because of all these problems, so okay, because of all these problems, so you can say consequently, you can use the word consequently as a result, consequently, comma, what happened? You ordered blood tests. So ordered blood tests. So you make a full sentence with these points. Ordered blood tests. And these blood tests revealed what? Blood tests revealed elevated levels. Elevated levels. What elevated levels? So random, then fasting glucose. Okay. So glucose levels. Glucose. Okay. Glucose, random and fasting. Okay, random and fasting glucose levels, and right, and HbA1c. Okay, this also. So this, right? So all these things, results are signs and symptoms. So based on this one, okay, signs and symptoms. What signs and symptoms? So these are the signs and symptoms. So signs consistent with type 2 diabetes mellitus. Signs consistent with type 2 diabetes mellitus. That is what you have noticed. That's very clear. So this is what you'll write in the second paragraph. From the past till the previous visit. Okay, present visit will come next. Present visit will come afterwards. Okay. Now these are the things which we have noticed here. Okay. So last visit, and this is review. Last visit and review here. Review of the test 4-2. Okay. So tests were there. So review was taken now. Okay. 4-2. There was test conducted and the results have come already there. Okay. So those review of tests organized on 4-2. So now you are reviewing because you got the test results and everything on the next visit. That is 24. Okay. That means after 20 days, means 3 weeks. Okay. All these things you can see here. Right. So based on this, okay. Now you write the second paragraph. Write the second paragraph. Dr. Momal, very good. Yes. You can write the second paragraph now. First paragraph, those who have finished, you can write the second paragraph. Yes. Did anybody write so far? Yes. Submit your paragraph, please. Mr. Brett Collister presented to us with decreased vision on assessment diagnostic. Type 2 diabetes mellitus requires further assessment and appropriate management plan following a discharge today. Points are clear, but grammatically mistakes are there. Okay, no problem. We'll be discussing. Yeah. Take 2 more minutes and write a complete paragraph. Yes. Practice, practice. Yes. Yeah, Dr. Momal has written. What about the others? He has had several infections during the past 2 years. During the last year or past year, not years, on 4 February 2018, presented to us with a dizziness, sore eyes, tiredness, possibly because of orthostatic hypotension. Okay. As a result, I ordered. So I should not come. He should not come. Okay. Blood test was which was ordered. Okay. You can say blood tests were ordered. As a result, I ordered blood tests. Results of blood test is following in with random. Glucose and fasting glucose levels are elevated with high HbA1c, possibly leads to type type 2 diabetes mellitus. Okay, others. Yeah. Points are there, but grammatically little errors are there. No problem. We can see later. We can see in the personal sessions. Yeah. What about the others? I'm waiting for your sentences. Yes. Right. So 1 minute more. Others also right, no? Nurses also right. Yeah. So now third paragraph. So nobody wrote. Why? What happened? Try, na? So third paragraph. The third paragraph. The third paragraph. Yeah. Somebody else. Aiden Sakar. Very good. Very good. So you people are writing. Okay, okay. I'll give you 1 more minute. No problem. Yeah. So the third paragraph. The third paragraph, what you will write. So he's a personal. Okay, his lifestyle, his personal things. So second paragraph, you wrote about signs and symptoms and tests and other things. Then here, the third paragraph, you write about his history. Okay, his history. For example, personal lifestyle. Okay, so you can talk about, yeah, what is he talking about? Yeah, you can talk about body mass index. Body mass index. So BMI. You can write about BMI, body mass index. So you can write about body mass index, about his overweight nature. Then next one is number 2. You can write about his hobbies, lifestyle. What are his lifestyles? Okay. What are his lifestyles? So here, background, hobbies. So this background, married and 3 children, 18, 16, 13, watching football and playing darts. So these are his hobbies. And watching football, no activity, playing darts, one place, fishing, sitting in one place. Okay, so they are not very active. Okay, activities. So physical activity is very less, you can say, and you can say that it is not a very special lifestyle, active lifestyle. You can say that is the reason why he became obese, overweight, because no activity is there. Passive lifestyle or sedentary lifestyle or passive lifestyle, you can say. Okay, no adjustment to lifestyle. See here, no adjustment to lifestyle, unfit, unfit. Okay, no exercise, no adjustment to lifestyle, no proper diet, no proper exercise, nothing is proper, unsystematic lifestyle. So you can talk about his hobbies. His hobbies. You can write about his hobbies. Okay, and they are inactive hobbies, not very active. You can say he is glued to one particular place. Okay, or he is sedentary or unmovable. Okay, not very active. Means he is not dynamic. Sedentary means not dynamic, not very active lifestyle. Not active or passive lifestyle, you can say. Passive lifestyle, just everything at his place. Passive lifestyle. Inactive lifestyle, no dynamic lifestyle. Okay, stationary lifestyle. Whatever you want to say, you can say sedentary lifestyle. Okay. Then after that, yeah, Pranita has written very good. Anjana has written very good. Yeah, I was thinking what happened to you people. Very good. They're thinking and writing. Very good. So next one is watching football, playing darts, fishing. So these are inactive lifestyles. And then right. So here passive lifestyle. Where is it? Overweight, unfit, no adjustment. Okay, reports busy at work. Okay, fine. These are his results. But before that, yeah. Before that, yeah. So now here you can see here, he's getting the treatment for shoulder. He's getting the treatment for shoulder here. So sore left shoulder triggered at the game of darts 2 weeks before. Okay, he's seeing the physio. Okay, he is seeing the physio or physiotherapist, or he's getting the physiotherapy exercises. He's getting the physiotherapy exercise program. Okay, and he's going for the shoulder treatment. He's going for the shoulder treatment. And anything else? Rotator cuff tear. Okay. Next, knee also here. See here. He has problem with the knee also. So shoulder and knee both. Okay. So pain intermittent, what's going upstairs. So he's getting the treatment for shoulder and knees also. Shoulder has improved, but knee has not improved. Okay. Intermittent pain. Okay. So this one you can write physiotherapy exercises. Number 3. Physiotherapy exercises. Physiotherapy exercises. So he's visiting the physiotherapist. Okay. He's visiting the physiotherapist and is getting treatment for shoulder and knee. So knee. Okay, first shoulder has come. Shoulder and knee. There he is under treatment. He's under treatment. Okay, he's under treatment here. Even after that one, yeah. Shoulder. Right. After treatment also, now you can see here, his overweight. Weight is 94 kilograms here. BMI is 30, which is overweight. Okay, is overweight. Temperature 38.7. Okay, tonsils inflamed, run down. Yeah. Yeah. Here weight 93. And here also weight 94. Here 94, here 93. That's nominal, phenomenal, not very extravagant. 29.7. Here it is 30. Overweight only still. Okay. So blood tests were ordered. You can see there. So weight reduction not happened. Fourth one. Weight reduction. Weight reduction did not happen. Did not happen. Okay. Weight reduction was not successful. Whatever it is, weight reduction was not successful. And next one is review of tests. Okay, high, still elevated this thing. And then advised to physio, review in 3 months. Refer to a physiotherapist. Okay, so treatment. Advised to reduce weight, weight reduction. But weight reduction, it did not happen. So weight reduction and increasing exercise regimen were recommended. Reduce weight and increase exercise. And participation in activities like cycling and swimming were suggested. So you can write advice. Weight reduction was recommended. Increasing exercise program, okay, from mild to moderate is suggested. For example, participation in cycling and swimming was advised. Like that you can write. Okay. So fitness. This is fitness. This is related to fitness. Okay. Already we have seen. Okay. Feels tired and stressed. Right. Shoulder has improved. Yeah, he's unfit still. He is unfit. Fitness is not right. So you can write about weight reduction. And number 5th point is fitness. He did not achieve fitness still. He is not very fit for everything. Okay. Fitness is missing. Right. Fitness is lacking or fitness. So did not increase the fitness standards. Fitness standards were not as expected. Fitness standards. Okay. So they did not increase, no progress in the fitness standards. So this is the 3rd paragraph. This is the 3rd paragraph. Right. So you can write the 3rd paragraph using this information. You can write the 3rd paragraph using this information. So this is his general condition, personal history. Personal history. Personal history. So next paragraph you can write about the medical history. So 4th paragraph. So 4th paragraph. the fourth paragraph. Fourth paragraph, you will write about the medical history. What medical history do you have here? Okay, what are the medical history? Medical history. Yeah, medical history, two things are there. No known allergies, okay, and infectious mononucleosis, February 2006. These are the two things related to medical history. So you write about the medical history. Only two sentences. Your medical history related to what? No known allergies. That is one. Okay, that is one sentence. And another sentence is infectious mononucleosis. So that is the second one. So now you have got third paragraph and fourth paragraph. That's all. Now next we'll write the conclusion. We're coming to the close. Come on, write down these two paragraphs. Third and fourth. So for the new batch, we have 2 places for doctors and 2 places for nurses. If anybody is interested, you can contact me. Yes. A conclusion sentence I will write. So the conclusion. The conclusion sentence I will write for you. Because you have to repeat the purpose here. So for now, I will write. Okay. So you can write like this. Having considered the above mentioned circumstances or based on the in view of the above, in keeping the above circumstances in mind, or like that, having considered the aforementioned circumstances, comma, so like that you have to write. Having considered the aforementioned circumstances, a definitive diagnosis okay, a definitive diagnosis and an effective follow-up plan would be profoundly beneficial. Yeah, would be profoundly beneficial. would be profoundly beneficial. Okay. Then or you can say and a definitive diagnosis and recommendations recommendations for follow-up activity, recommendations for management would be profoundly beneficial. Full stop and continuation. In case any additional information is deemed extremely relevant, please do not hesitate to contact me. And afterwards, you are faithful, you are sincerely sorry. So this is how it is. So third paragraph, fourth paragraph, fifth paragraph. Yeah. Right. Yes, blessing Ersaba. Shabnam, good morning. Yeah. So if anybody has missed the session, you can watch from the YouTube. I'll give you the links. Yes. Very good blessing. Yes. Yes. Yeah. Yes. So complete the sentences and afterwards write this letter and send it to me. In this group, anybody is there who is going for exam on the 25th? Message me personally. Or type in the chat box. March 25, test date. Anybody going, just message me personally or type in the chat box. So I'll be calling you. First priority for the exam students. Hello, Muhiba, Dr. Muhiba. Are you busy? You can unmute. Okay, if you are busy, no need. So I'll send you the link if you are late for the class. So write the letter and submit me. Yeah, I can understand. So I'll send you the link. You can request me and I'll send you the link in the group now. So complete the letter and submit me. All of you finish the letter. Yes, Dr. Farid, very good. I have sent the link in the regular group. Yes. So that's the end of the session. And just type your test date if you have already booked. Okay. So that I can call you for speaking and other sessions. Copy. Yes. So that's the end of the session. We'll meet again later. You can just message all of you. Those who attended the session can message me personally so that I can follow up with you for speaking